Pathologic tooth migration. Pathologic tooth migration means tooth displacement from the normal position. Movement occurs due to loss of balance of forces that were able to maintain the teeth in the normal position. So by definition, pathological tooth migration is the tooth displacement that results when the balance among the factors that maintain the physiologic tooth position is disturbed by factors like periodontal disease. So in pathologic tooth migration, there is an imbalance among the factors due to periodontal disease. Pathologic tooth migration is one of the most common finding and the complication of moderate to severe periodontitis, and that can lead to aesthetic problems. This is a motivation for patients to seek periodontal therapy. Prevalence of pathologic tooth migration. It occurs in periodontitis cases about 30 to 35% of the cases. It is common in anterior sextant, but even the posterior teeth may show pathologic tooth migration. It is an early sign of disease or may occur as the periodontal disease progresses. A diagnosis of pathologic tooth migration can be made by asking the patients whether they were aware of the movement of the teeth in the anterior region in the last 5 years. Clinical features of pathologic tooth migration. There is tooth mobility, there is rotation of teeth, diastema or the spacing between the teeth can be seen, the teeth become flared, and there is extrusion or movement in occlusal or incisal direction of the teeth. Radiographic features of pathologic tooth migration. There is alveolar bone loss associated with pathologic tooth migration. It's always associated with some degree of bone loss, and it is important to detect migration during its earlier stage so that further serious involvements can be prevented. Etiology and pathogenesis. Normal position of the teeth is maintained by two factors: the health and the normal height of the periodontal attachment apparatus and the forces that are exerted onto the teeth. Forces could be in the form of occlusion and pressure from the lips, cheeks and tongue. Forces of occlusion depend on tooth morphology and the cuspal inclination, presence of full complement of teeth, physiologic tendency toward mesial migration, nature and location of contact point relations, proximal, incisal and occlusal attrition, and the axial inclination of the teeth. All these factors influence the forces of occlusion, and when there is any alteration in these factors, it results to pathologic migration of single tooth or a group of teeth. Pathologic migration occurs when there is weakening of the periodontal support, when there is modification or increase in the forces exerted on teeth, or a combination of both these factors. So coming to weakened periodontal support, periodontitis is associated with periodontal bone loss. It is an inflammatory destruction of the periodontium. In this case, there is an imbalance between the forces that maintain the tooth in position. Tooth with weakened periodontal support cannot bear the occlusal and the muscular forces, especially from the tongue. So this results in movement of the teeth from the forces that are exerted on them. The reason for pathologic tooth migration in weakened periodontium is forces may be normal and bearable for intact periodontium, but it is injurious in case of reduced periodontal support. Weakened periodontal support can occur due to conditions like abnormal proximal contacts. These abnormal proximal contacts lead to normal anterior component of force becoming a wedging sort of force. Wedging force results in occlusal or incisal movement of the tooth. Due to this force, the tooth extrudes when the periodontal support is weakened by disease. As the tooth position changes, it is subject to abnormal occlusal forces, which aggravates the periodontal destruction and results in tooth migration. Pathologic tooth migration may continue even after the tooth does not come in contact with antagonist. The reasons could be pressure from the tongue, food bolus during mastication, and the proliferating granulation tissue that provides the force for the movement. Pathologic migration is an early sign of localized aggressive periodontitis. Due to loss of periodontal support, labial drifting of maxillary and mandibular anterior incisor is seen, which is followed by extrusion and creating diastema between the teeth. Second reason is changes in the forces exerted on the teeth. Changes in the magnitude, direction, or frequency of the forces exerted on the teeth can lead to pathologic migration of a single tooth or group of teeth. Unreplaced missing teeth or other factors can result in changes in the magnitude, direction, and frequency of the forces. These forces do not have to be abnormal to cause migration in a weakened periodontium. Now, pathologic migration of a tooth or group of teeth can result due to unreplaced missing teeth or other factors. Unreplaced missing teeth can lead to spaces. These spaces result in drifting of teeth. Drifting of teeth creates condition that leads to periodontal disease, and eventually there is initial tooth movement which is aggravated by the loss of periodontal support. Drifting is common but does not always occur, but when it occurs, it generally occurs in the mesial direction. Premolars are seen to frequently drift distally. Drifting can occur along with tilting or extrusion beyond the occlusal plane. Failure to replace first molars. This leads to a pattern of changes. When the first molar is not replaced, first step is second and third molars tilt mesially, which results in decrease in the vertical dimension. Second, the premolars move distally and the mandibular incisors tilt or drift lingually. The mandibular premolar lose their cuspation relationship with the maxillary teeth and further distal tilt is seen. Anterior overbite is increased. Mandibular incisors hit the palatal gingiva of the maxillary anterior teeth or even cause trauma to the palatal gingiva. Next step involves maxillary incisors being pushed labially and laterally. The anterior teeth extrude, which results due to the lack of contact with lower teeth and separation. And finally, there is diastema that is created by the separation of the anterior teeth. So, failure to replace teeth can lead to disturbed proximal contact relationships. This can lead to food impaction, plaque accumulation, and pocket formation, ultimately causing bone loss and tooth mobility. Tooth positions are altered, the occlusal disharmony results. Trauma to the supporting tissue of the periodontium is seen, and there is aggravation of destruction caused by inflammation. All these results in further migration of teeth, resulting pathologic tooth migration. Other causes include trauma from occlusion, pressure from the tongue, and pressure from the granulation tissue of the periodontal pockets. Trauma from occlusion results in shift in tooth position. It is either by the forces itself or along with the presence of inflammatory periodontal disease. Pressure from the tongue causes drifting of the teeth in absence of periodontal disease. Pathologic tooth migration in teeth with reduced periodontal support is seen. Pressure from a granulation tissue of periodontal pocket can be a contributing factor to pathologic tooth migration. Presence of periodontal pocket results in weakening of tooth support, which is caused by periodontal destruction. However, elimination of these pockets can cause the teeth to return in their original positions. So, treatment of pathologic tooth migration. Correction of pathologic tooth migration can be divided into 4 categories. First involves extraction and replacement of teeth when migration is very severe. Second is spontaneous correction of the early stages following periodontal therapy. Limited or adjunctive orthodontic therapy can be performed, or conventional orthodontic treatment can be performed to correct the pathologic tooth migration. The strategies involved: pathologic tooth migration in early stages can be corrected by periodontal therapy alone. It could either be non-surgical or surgical, and it can produce spontaneous correction of the migration. In moderate to severe cases, there is a team approach that is required for success. The sequence involves periodontal therapy followed by orthodontic therapy, which usually involves fixed appliances. Prosthodontic therapy is often required following orthodontic therapy. Light intrusive orthodontic forces are effective in treating extrusion and flaring if inflammation is controlled during all the phases of treatment. Most patients with pathologic tooth migration have moderate to severe periodontitis. Successful orthodontic treatment is possible if inflammation is controlled in these patients. How to prevent pathologic tooth migration? Tooth migration related to periodontal disease and other etiologies is preventable. Control of periodontal disease is the most single effective method to prevent pathologic tooth migration. control of drug-induced gingival overgrowth, treatment of occlusal factors and habits that cause tooth migration, early detection of pathologic tooth migration and treatment of early stage can be reversible with periodontal treatment only. So to summarize, pathologic tooth migration is tooth displacement that results when the balance among the factors that maintain the physiology of tooth position is disturbed by periodontal disease. The etiology involves weakening of periodontal support, modification or increase in the forces that are exerted on the teeth, or the combination of both. Clinical features involve rotation, diastema, extrusion, flaring and mobility of the teeth. Treatment involves extraction and replacement in severe cases, spontaneous correction in early stages with periodontal therapy, limited or adjunctive orthodontic therapy, and conventional orthodontic treatment. You can find the link to MCQs for this topic in the description of the video. Thank you for watching the video. If you liked it, please subscribe to the channel and hit the notification bell for update on new videos.